Hello, my name is Nurse Pauline RN. Welcome to my channel. Hope all is well. Today, we will be talking about isolation precautions. I'm going to remind you to hit your like button, hit your subscribe button that I can continue bringing you these videos. Hit your subscribe and your comment. Today, we'll be talking about airborne diseases. Our first disease is SARS. SARS is an infectious disease with symptoms with fever, cough, and in most cases, it can progress to pneumonia or respiratory failure. For airborne diseases, our next disease is measles and chickenpox and shingles. These patients are on airborne isolation. Patients with TB will be on airborne precaution. We will use an N95 mask for these patients. If they are exiting the room, they will use a surgical mask. They will be in a private room. We'll use gloves, masks, and gowns for these patients. And they will have a negative pressure room. If it's a private room, it has to be negative pressure room. We need also the sign to be on the door that visitors can report to the nurses station with the isolation signs on the door. Our next disease is droplet precautions. Patients who are on droplet precautions are patients with diphtheria, epiglottis, mumps, parvovirus, rubella, German measles. Patients with scarlet fever, sepsis, streptococcal pharyngitis. These patients are on droplet precautions. Patients will be coughing, they will be sneezing. We're going to be wearing our gowns or gloves, taking care of these patients. We'll be using masks because these patients will be coughing. The patients should be in a private room. Patients, if they are leaving the room because of the cough, we will have them wear a surgical mask outside the room. We will put a sign on the outside of the door for visitors and families, and these patients will be in a private room. These patients, when they are coughing, the nurses, we should stay at least 3 feet away from these patients. The next patients we are going to talk about are the patients who are going to be on contact isolation. Patients on contact isolation, some with enteric infections, patients with C-DIFF. We are going to be wearing our gloves for all these patients, gowns for all these patients. If they are coughing, PRN, you can wear your mask, PRN. We will assess these patients because some of them will have wound infections. We need our gloves. We need to practice safe hand washing hygienes on these patients. After you remove your gloves before leaving the room, you have to wash your hands with running water. Patients on contact precautions, they have wound infections, skin infections. Some of these patients have lice, scabies, streptococci, bacteria. Some of these patients, they have chickenpox or shingles. For patients on contact isolation, we have to practice hand washing. Can't be too often. When you touch the countertops, the bed rails, the machines in their rooms, wash your hands. Doorknobs, wash your hands with running water, changing the bed linens, checking their blood pressure, temperature. They need their blood pressure, disposable blood pressure cuffs in the rooms. And next, we're talking about standard precautions. Standard precaution is used on all patients. We use gloves in between all patients. If you're in the room, if you're feeding them, doing their bed linens, checking their blood pressure, disposable blood pressure cuffs, thermometers with disposable caps. We will wash our hands in the rooms as many times as needed. For standard precaution, we're trying to prevent needle sticks. We do not recap. We're trying to prevent hepatitis B. For patients with equipments in the room, clean the equipment as many times as needed. Sometimes there are spills of body fluids on equipment. Maybe the patients throw up, or clean the equipment as many times as needed. We can call the housekeepers to come and sanitize the rooms. We don't have to wait for discharge to clean these patients' room. We always wash our hands in between patients. If patients are on standard precaution, we don't forget to cough in our sleeves. Encourage the patients also. If we need to wear masks, we wear masks, PRN. Some infections in the hospital are nosocomial infections. These are hospital-acquired infections. Some patients will have C-DIFF. This is a hospital-acquired infection. C-DIFF is Clostridium difficile, and we have to practice hand washing. These patients will have a lot of loose stools. We have to wash our hands in between. There's another nosocomial infection called VRE. This is called vancomycin resistant enterococci bacteria. Nosocomial infection, we also have MRSA. This is methicillium resistant Staphylococcus aureus bacteria. All hand washing for these patients, in between patients, as many times as needed. All nurses need to wear short nails, no artificial nails in the hospitals. Nosocomial infection is caused by people in the hospitals, staff members not washing their hands, failing to wash their hands. They change their gloves. They do not wash their hands in between patients. Use the hand sanitizers on the doors, and encourage family members to wash their hands when they're leaving the patient's rooms. Formite is physical object that serve to transmit an infectious agent from one person to another. Bed linens, clothing, utensils, furnitures. Wash your hands. VAP stands for ventilator assisted pneumonia. These are seen for patients in the ICU on ventilators. Hepatitis B is transmitted through needle sticks in the hospitals. Pathogens in the hospital, they grow on hands, they grow on bed linens and wound drainage. CLASBI, this stands for Central Line Associated Bloodstream Infections. These are from patients who have central lines. The central lines gets infected while they're in the hospitals. Thanks for listening, guys. Hit your thumbs up. hit your subscribe button if you want me to continue bringing you these videos. Please share my videos and please comment. Have a blessed day. Take care. Stay blessed. Thank you.